Have you ever found yourself avoiding outings, skipping gatherings, or even holding back from doing the things you love because you're worried you might not make it to the bathroom in time? If so, you're far from alone, and it's nothing to feel ashamed about. In fact, more seniors than you might think struggle with fecal incontinence. And while it can be frustrating, embarrassing, or even overwhelming at times, the truth is that this condition is manageable. And with the right approach, you can regain confidence, protect your dignity, and continue living a full, vibrant life without fear holding you back. The reality is that as we get older, our bodies change. Muscles weaken, digestion slows, certain medications affect bowel function, and sometimes health conditions like diabetes, nerve damage, or past surgeries can play a role. For some, it comes on gradually, maybe a little leakage here and there, or not being able to hold it as long as before. For others, it may be sudden and unpredictable. But here's the most important thing I want you to remember. While it may feel isolating, this is a medical condition, not a reflection of your character, your strength, or your worth. And just as you'd care for your heart, your joints, or your memory, your digestive health and bowel control deserve attention too. So in this video, we're going to explore a doctor's perspective on what really helps when it comes to managing fecal incontinence after 60. We'll talk about why it happens, what simple strategies you can start today to reduce accidents, how diet and lifestyle changes play a huge role, and when it might be time to talk with your doctor for more advanced treatments. My goal is to give you hope and practical steps you can take so you don't feel trapped or controlled by this issue. One of the first things I want to highlight is the role of muscle strength. Just as we do exercises to strengthen our legs, our arms, or our balance, we can also strengthen the muscles that help control bowel movements. These are called the pelvic floor muscles, and they act like a sling, supporting your bladder and rectum. When these muscles weaken with age, bowel control becomes harder. Simple exercises, often referred to as Kegel exercises, can make a remarkable difference over time. The idea is to gently tighten and release the muscles you'd normally use to stop yourself from passing gas. At first, it may feel difficult or even confusing, but with a bit of practice, you'll find you can build strength and endurance. Many seniors who commit to doing these daily notice fewer accidents and more control within just a few weeks. Alongside muscle strength, your bowel habits themselves can make a huge difference. Some people with incontinence rush to the bathroom whenever they feel the slightest urge, while others try to hold it too long. Training your body with more consistent routines can help. Setting a schedule, such as visiting the bathroom after meals when your digestion is naturally more active, can reduce surprise accidents. It's a bit like retraining your gut to work with you instead of against you. Think of it as creating a rhythm for your body, just like sleep routines or exercise schedules. Now let's talk about diet, because what goes into your body directly affects what comes out. Fiber is one of the most important factors here. Not all fiber is the same, though. Soluble fiber, found in foods like oats, apples, bananas, and beans, helps absorb water and bulk up stools, making them easier to control. Insoluble fiber, found in whole grains and many vegetables, helps keep things moving. But too much can sometimes lead to looser stools, which can make leakage harder to manage. It's all about balance, and often, introducing fiber gradually while drinking enough water is the key. Many seniors find success with adding just one serving of fiber-rich food to each meal and making sure to hydrate throughout the day. Hydration itself deserves a moment of attention. Some people think cutting back on fluids will reduce accidents, but in reality, dehydration can make stools harder, drier, and more difficult to control. This can actually increase leakage. Sipping water steadily through the day, instead of gulping large amounts at once, helps keep things more regular and manageable. Think of water as lubrication for your system. Without it, everything works harder and accidents become more likely. And let's not forget about triggers. Just as some foods make heartburn worse, certain foods can irritate the bowels. Spicy foods, greasy meals, caffeine, and sometimes even dairy can be culprits. Everyone's body is a little different, so keeping a small food journal can help you connect the dots between what you eat and how your body responds. When you notice patterns, you can make small adjustments without giving up all the foods you love. It's not about restriction, but about balance and awareness. Now, while these lifestyle steps, strengthening muscles, creating routines, adjusting diet, and staying hydrated, form the foundation of managing incontinence, there's also the matter of confidence and peace of mind. No one wants to live in fear of accidents when they're out shopping, visiting friends, or enjoying a meal at a restaurant. There are discreet products, clothing options, and hygiene aids that can help you feel protected without drawing any attention. Modern products are far more comfortable and discreet than many people realize, and using them doesn't mean you're giving in. It means you're taking control. This is just the beginning of what we're going to cover, and I want you to take a moment to really let this sink in. You are not alone, you are not powerless, and you absolutely have the ability to improve this part of your health. Small changes can build into big results, and the freedom you gain is worth the effort. When we think about health after 60, most of us focus on our heart, our bones, or our memory, but bowel health is every bit as important to living fully and independently. And while exercises, diet, hydration, and routines create a strong foundation, there are also medical insights and practical tools that can bring even greater relief and peace of mind. This is where a doctor's perspective can really help, because sometimes what feels like an unmanageable condition is actually a problem with very clear solutions. One of the first things doctors look at when a patient reports fecal incontinence is stool consistency. Too hard, and you're more likely to experience leakage when straining, as well as possible damage to the muscles and nerves. Too loose, and you simply can't hold it as easily, which leads to accidents. Achieving the right balance, soft-formed stools, is key, and it's often more achievable than people think. That's why your doctor might recommend fiber supplements, stool softeners, or in some cases, mild medications that regulate bowel movements. For many seniors, these small adjustments make a significant difference within weeks. But beyond stool consistency, there's also the question of underlying causes. Sometimes incontinence isn't just about aging muscles, it may be connected to chronic conditions like diabetes, multiple sclerosis, Parkinson's, or even complications from surgery or childbirth earlier in life. That's why speaking openly with a healthcare provider is so important. A doctor can run simple tests to check the strength of your pelvic floor, assess nerve function, and even do imaging if necessary. While it may feel embarrassing to bring up, remember that your doctor has seen it all before, and their goal is to help you get your confidence and control back. For many seniors, one surprisingly effective step is biofeedback therapy. This is a technique where sensors are used to help you understand how your muscles are working and guide you in strengthening them more effectively. It's almost like having a personal coach for your pelvic floor. Studies have shown that biofeedback can significantly reduce leakage episodes, especially when combined with regular at-home exercises. If you've tried Kegels and felt like you weren't making progress, biofeedback can help you see what's working and what's not. Another medical approach that's growing in popularity is sacral nerve stimulation. This involves a small device, similar to a pacemaker, that sends gentle signals to the nerves controlling your bowel muscles. For people with severe or persistent incontinence, this can be life-changing, restoring control where other methods haven't worked. It's not for everyone, but it's worth knowing that technology is providing new hope even for difficult cases. Of course, not every solution needs to be high-tech. Sometimes simple adjustments like adjusting medications can make a difference. Many prescriptions seniors take, such as certain blood pressure drugs, diabetes medications, or even over-the-counter remedies, can cause diarrhea or constipation, both of which increase the risk of leakage. That's why it's so valuable to have your doctor review all of your medications together. Something as simple as switching brands, adjusting timing, or balancing with dietary changes can ease symptoms dramatically. And then there's the emotional side of this condition, which often goes overlooked. Living with incontinence can chip away at confidence. You may find yourself withdrawing from social activities, saying no to travel, or avoiding hobbies you once loved. But isolation only makes the problem harder. This is where support becomes critical. Support can mean practical, like talking openly with family members or carrying discreet supplies in your bag for reassurance. But it can also mean emotional. Talking with others who face the same challenges, whether in a local support group or even an online community, helps you remember you're not the only one. Hearing stories of improvement can give you the motivation to keep trying new strategies until you find what works best for you. Another practical tip many doctors recommend is bowel retraining through diet timing. Instead of eating large meals late in the evening, try to shift your biggest meals earlier in the day. Digestion is naturally more active after eating, so planning bathroom visits around mealtimes can help you anticipate urges instead of being caught off guard. Even something as simple as having a warm beverage in the morning can gently stimulate your bowels and give you more control over when you go. And while managing incontinence takes patience, it's important to celebrate progress along the way. Maybe you've gone from 3 accidents a week to just 1, or you've started to feel more confident leaving the house again. These are not small victories. They're signs that your body is responding, that your efforts matter, and that control is being restored one step at a time. The key is not to give up, even if the first solution doesn't completely fix things. Managing this condition often takes layering different strategies, muscle exercises, dietary changes, doctor-guided therapies, and lifestyle adjustments until you create a system that works for your body. And with each layer, you gain back another piece of independence, another piece of confidence, another piece of life that you may have thought was lost.